of regional lymph nodes, main groups of regional lymph nodes, and that's it. Okay, and now, no, but certainly you have to read also textbook. And now vessels of lower limbs. The main source of blood supply for the upper limb, or sorry, lower limb, it is femoral artery. This we don't need. I think I asked you to take out
preparation with the vessels.
With vessels, yes. Which vessel have you seen in this preparation? I'm very much interested. Latin class today.
Ma'am, I'm passed in Latin.
Okay.
3 weeks ago.
3 weeks ago. Okay, good. So this is femoral artery, yes. This is also femoral artery, and we have already said that after external iliac artery passes through vascular space, it becomes femoral artery. Yes, and then femoral artery has a very interesting topography. So first it lies in the femoral triangle. How femoral triangle is formed, you will revise. In the iliopectineal groove, yes. Then it enters adductor canal. How adductor canal is formed, you will also revise. And it leaves the adductor canal through the adductor fissure. And then it comes to the popliteal fossa. How popliteal fossa is formed, you will also revise. And so after it enters popliteal fossa, femoral artery becomes popliteal artery. So what are the branches of femoral artery? The largest branch of femoral artery. No, okay, let's start with branches. Let's see it here. So first let's start with branches which arise right after femoral artery starts, yes. And first of all, it is superficial epigastric artery, arteria epigastrica superficialis. It goes in the subcutaneous fatty tissue, yes, of the anterior abdominal wall at the same level with inferior epigastric artery, but inferior epigastric artery supplies muscles, and superficial epigastric artery supplies skin and subcutaneous fatty tissue of this region, and it also goes upward, reaches level of the umbilicus, and forms anastomosis there with superior and inferior epigastric arteries. The other artery, which arises at the same level with superficial epigastric artery, it is superficial circumflex iliac artery. Here we cannot see it, but it goes parallel to the iliac crest. It forms anastomosis with deep circumflex iliac artery. That is a branch of external iliac artery, and after it reaches posterior superior iliac spine, it also forms anastomosis with lateral sacral artery and iliolumbar artery. Then another branches which arise from femoral artery. Maybe it was superficial circumflex iliac artery. Yes, probably. Like that. Okay, so the other branches. First of all, the largest branch, it is deep femoral artery, arteria femoris profunda. It goes backward between muscles of anterior group of the thigh, and it gives 3 perforating branches. It can be, like in different books, it's written superior, middle, and inferior, or it can be first, second, and third perforating branch. These perforating branches, they move backward, and they supply posterior group of thigh muscles. The third or inferior perforating branch gives descending branch that goes downward and supplies the knee joint, and it participates in formation of arterial network around the knee joint. Here in the knee joint there will be no paired anastomosis, but it will be like a network of anastomosis, and totally there will be about 11 vessels here which form arterial network around the knee joint. The next, medial and lateral circumflex femoral arteries. This is lateral circumflex femoral artery. Usually both of these vessels arise from deep femoral artery. So this is lateral circumflex femoral artery. It goes laterally at the level of the neck of the femur, and it gives 3 branches: ascending branch, descending branch, and transverse branch. Transverse branch participates in blood supply of the hip joint. Descending branch of lateral circumflex femoral artery goes also downward and participates in formation of arterial network around the knee joint. And ascending branch goes upward, and it forms anastomosis with superior and inferior gluteal arteries, which are branches of internal iliac artery. And in case of occlusion of femoral artery above the origin of lateral circumflex femoral artery, so this anastomosis can provide at least partial blood supply of the lower limb. Yes, so this is very clinically significant anastomosis. The other is medial circumflex femoral artery. Usually they arise on the same level. Here, probably this one. It goes medially. It also surrounds surgical neck of the neck of the femur. They form anastomosis with each other, and they supply hip joint, medial circumflex femoral artery. Also, femoral artery gives external pudendal artery. Here I cannot see it.
With which one? Medial circumflex will be anastomosis?
With lateral. What? This one is lateral. This one is medial. And here I also cannot see external pudendal. So external pudendal, the other branch, it goes medially to the external genital organs, and in males it ends with anterior scrotal branches to supply scrotum. In females it ends with anterior labial branches to supply major pudendal lips. That's it. Okay. When femoral artery passes inside the adductor canal, it gives one more branch that is named descending genicular artery, arteria descending genus. And so this artery leaves adductor canal through the anterior opening together with saphenous nerve. So you will read about adductor canal. You will revise that it has three openings. Yes, superior, inferior, and anterior. And so through this anterior opening, saphenous nerve leaves, and also descending genicular artery. Descending genicular artery that goes downward and thank you, and also participate in formation of arterial network around the knee joint. So that was about femoral artery. Yes. Now popliteal artery. Arteria poplitus. It is located in the in the popliteal fossa. And at the level of inferior angle of the popliteal fossa, this popliteal artery